The pandemic has affected and delayed many aspects of life. Now, the National Cancer Institute estimates that delays in cancer screenings due to the pandemic could result in over 10,000 deaths over the next 10 years. I spoke with local medical professionals to hear if they're seeing similar trends and have the same concerns here in Eastern North Carolina. They tell me their biggest concern is finding something their team could have treated much earlier on.
We want to find cancers in their earliest stage. They are obviously much more curable when they are, stage 1 or stage 2. And so if we are not screening appropriately, we may end up with cancers that we find more in later stages where they're not as curable.
Experts say it just wasn't on people's list of priorities when COVID-19 hit, or they were nervous. Dr. Darla Lyles, an ECU professor of medicine and chair of Vidant Health's Commission on Cancer Committee, says 2 types of cancers in particular had the largest drop in screenings.
Breast cancer screening with mammograms, colonoscopies, they went to basically zero during the pandemic.
David Williams, manager of radiology and diagnostics at Carolina East Medical Center, says his biggest worry is that when patients miss an appointment, it becomes easier to prolong that absence.
Once a patient misses a screening or 2, it increases their opportunity to miss more screenings because it becomes kind of an out of sight, out of mind kind of situation. Obviously, the more delay there is in those annual screenings, the more opportunity for something to come up and to present to place any of our patients at risk.
Both experts tell me if you've missed a cancer screening appointment, don't worry, but it's important to get one scheduled as soon as possible. That appointment could be the difference between life and death. For WNCT News, I'm Emily Severidge, 9 on your side.